Hi, I'm Christina Bausch. I am a physical therapist and a pelvic floor specialist here at Rebound. We are an outpatient clinic located in Topeka, Kansas. Today I'm going to talk to you a little bit about pelvic floor prolapse. So we're going to talk about the three main types of prolapse and how therapy can help with those. So first I'm going to talk a little bit about just the anatomy of the pelvis. So if you look at the pelvis from the side or from the front, so there's the pubic bone here in the front, there is the spine and the tailbone coming down the back, and then there's all these muscles down in the bottom of the pelvis, which kind of form a bowl, which is going to be the support for the pelvic organs from the underside. And so what we want for those muscles is that they are strong and functioning so that they're providing good support for all of your pelvic organs. So when I say your pelvic organs, the main three are going to be your bladder, your uterus, and the bowels. So let me give you a little visual here. So if we look at the anatomy from the side, so again, we're looking at the pubic bone here in the front, your tailbone's going to be back here in the back, and those pelvic floor muscles are going to kind of form a sling underneath to provide support. So what we want is for those organs to stay nice and tucked up inside. So sometimes what can happen with prolapse is that those organs may start to sag or bulge. So the bladder may kind of fall back into that vaginal wall, and depending on how severe the prolapse is, it may actually bulge down so that you're actually seeing some bulging there at the vaginal entry. So the bladder can prolapse backwards. The bowels can also prolapse forward. So sometimes you'll see some bulging into that vaginal wall from the bowels moving forward, or the uterus itself can shift down. So all of those scenarios can happen, but we treat them more or less in the same ways. Some of the signs that you may be experiencing some prolapse may be some dullness or some heaviness within the lower abdomen. You may also feel heaviness in the perineum or vaginal area. Sometimes you may have difficulty either emptying your bladder completely or completing a bowel movement. So those could be some symptoms. Sometimes there's some pain. Sometimes it may just be discomfort, or you just may notice some bulging at that vaginal entry that you notice isn't normal. So some of the things that we can do to help in this situation is that we are going to work on improving that strength and the coordination of those pelvic floor muscles from the underside. So teaching you how to isolate and contract those muscles, especially with activity. So some of the factors that can worsen prolapse are, just day-to-day transitions, maybe some lifting, coughing, anything that kind of creates pressure or strain that pushes down on the bladder. So when we're thinking about this, we're both thinking about how much support is there from the underside compared to how much pressure there is within that abdominal cavity that is pushing down. So one way that we can work to minimize prolapse is by not only working to engage or contract the muscles from the bottom side, but also working on your breathing techniques as you're doing transitions or doing exercise or activity, so that we're minimizing how much pressure is pushed down on those pelvic organs. So we work a lot on coordinating with breathing. Anytime you do any kind of exertion, we really want you to work on exhaling so that that's minimizing how much pressure is pushing down on those pelvic organs. Common factors that may kind of lead into a history of developing some prolapse. So sometimes people that have respiratory issues maybe have a chronic cough. Maybe you've had chronic constipation all your life or for even a period. Of course, childbirth can definitely be a trauma on those muscles and organs. So any of those factors can lead into developing prolapse. But then hopefully once we identify that that's what's going on, we can put together a treatment program to either improve your strength, or maybe it's possible that those muscles aren't necessarily weak. Maybe they're just discoordinated, or maybe because you felt that pressure, maybe you've developed a tendency to hold some tension in those muscles. So we can work to reset the muscles and then teach you how to engage them properly, coordinate it with your breathing to minimize how much pressure is pushed down on those organs. So if you're experiencing any of these symptoms, please just give me a call. I'd be happy to sit down and talk to you, and we can develop a plan to resolve your symptoms.